Welcome to our Anti-Doping Podcast brought to you by UIPM, which is the International Federation of Modern Pentathlon Olympic Sport. Our mission with this podcast is to raise awareness about clean sport and provide pentathletes, their coaches, fans with the latest insight on anti-doping. I'm Thomas and I have a PhD in biochemistry. Alongside me is my colleague Christian, who holds a PhD in pharmacy. We are both anti-doping experts dedicated to promoting clean sport. In this podcast series, we'll focus on prohibited substances and the rational use of dietary supplements, offering valuable information to help you navigate these complex topics. Welcome to another episode of our Anti-Doping Podcast. Today we are diving into two critical yet often overlooked aspects of athletic performance, pain and sleep. Pain is an inevitable part of sports, but how should we manage it? Should we push through, or does suppressing pain lead to bigger risks? And on the other side, sleep, something we all do, yet many athletes underestimate its impact. How does sleep affect performance, injury recovery, and even doping risk? To break down these topics, I'm joined by my colleague and expert in pharmacology and anti-doping, Christian. Welcome, Christian.
Thanks, Tomas. Pain and sleep are great topics because they are deeply connected. Pain affects sleep, and lack of sleep can increase pain perception and injury risk.
I believe that our listeners, our pentathletes, are quite interested in dealing with pain relief, but let's start with something maybe a little more basics, like what is pain and why do we feel pain at all?
So it's quite simple. When you get injured or something bad or harmful happens, specialized nerve receptors detect the damage and send signals through the nervous system to the brain, alerting that something is actually wrong. So pain in our body works like an alarm system.
We can discuss a lot about pain, its mechanisms, and so on, but I believe that the most common distinction in pain is acute and chronic pain. So can you break that down for us?
Absolutely. So acute pain is short term. It occurs after injury, let's say surgery or inflammation, and it usually results from damage of the tissue, like your sprained ankle or fracture or muscle tear. And chronic pain, on the other hand, is something that persists for months or even years, and it can be caused by two major issues, and those are nerve damage. Those are conditions like, for example, spinal injuries, or it can be developed when the nervous system becomes hypersensitive, leading to chronic pain, like chronic low back pain, let's say.
So while acute pain is something like a warning signal that something is wrong, chronic pain is more complex and can persist even after the original injury has healed?
Exactly, and that's where pain management can become tricky, especially in sports where the difference between safe treatment and risky suppression of the pain isn't always clear.
So as we are talking about so many aspects of pain, actually I'm starting to feel some pain in my back. So I think it's time to switch the gear and let's talk about pain relief. So what are the most common ways athletes manage pain?
Well, we have two main approaches. Those are divided into non-pharmacological treatments and those involving medicines, so pharmacological treatments. From the non-pharmacological ones, we can mention things like ice, heat, and physiotherapy. And from pharmacological methods, we can talk about medicines that are over-the-counter and those that are prescribed by your doctor.
Okay, so let's start with something familiar, NSAIDs. As we know the acronym for substances like ibuprofen. So what to do with them?
So let's break down the acronym NSAIDs. It stands for non-steroidal anti-inflammatory drugs. So it's quite a mouthful. And from now on we will talk about it like NSAIDs to make it short. And these substances are commonly used for injuries, muscle soreness, in the inflammation. And they work, and the mechanism of their action is that actually they inhibit enzymes that produce certain chemicals called prostaglandins, and these chemicals can cause pain and swelling. But there's always a downside, and overuse of NSAIDs can lead to different kinds of issues: stomach ulcers, kidney problems, slower muscle recovery, and so on.
Yeah, it can be quite surprising that we are trying to reduce pain, but on the other hand, athletes might actually be slowing down their recovery, right?
Exactly. Some studies suggest that excessive NSAIDs use may reduce muscle recovery and delay bone healing with fractures.
We have already mentioned ibuprofen. Are there any other medications which are quite common for athletes?
Let's break it down to those not so strong. So you have ibuprofen, you have diclofenac, you have aspirin, and those kind of substances that are often over-the-counter ones. And then the prescription medicines are usually opioids like morphine and fentanyl, and those are very powerful painkillers, and they have different mechanism of action rather than blocking the enzymes that produce prostaglandins. These kind of substances block pain signals directly in brain. They are very effective, but come with serious risks.
And what are those risks?
They're highly addictive. They can cause respiratory depression, then can impair reaction times, coordination, decision making, and from anti-doping perspective, as we are talking in the anti-doping podcast, they are banned in competition.
Yeah, I think that we agree that it's not a common practice that our pentathletes or athletes in general would take these substances to increase the performance. It's usually some injury behind this. But we have also another, let's say, controversial painkiller like tramadol. So what's the story there?
Well, it's mild opioid-like painkiller, which is very effective for moderate pain, not a severe one like opioids. It still carries a lot of risks like drowsiness, dizziness, and dependence. From anti-doping perspective, it used to be allowed, but now it is prohibited from 2024 when WADA prohibited it.
So remember that any pentathlete using tramadol before competition must be very careful and ask for TUE or change the medication with doctor. So be aware of that, right?
And we actually know the washout period for tramadol because WADA has published it, and it is 24 hours. So if you have competition on, let's say, Saturday, the last dose of tramadol should be on Thursday.
Yeah, so our common advice is always check the prohibited list before taking any medication, I would say. But before we maybe dive into the risk of taking any painkillers, let's be fair, there are cases where pain relief is necessary and even beneficial, right?
Absolutely. Pain management always plays a crucial role in recovery and performance when used correctly. It can help you with minor injuries and sorenesses, post-surgery rehabilitation in some competition scenarios. So pain management itself isn't the problem. The danger lies in ignoring warning signs and relying too much on medication and not listening to your body.
So we can say that the key is knowing the difference between pain and that can be managed safely and pain that actually signals a real problem?
Exactly. Pain is, as we have said, an alarm system. It tells pentathletes to stop, adjust, seek treatment. Suppressing pain without treating the injury can lead to damage. For example, if pentathlete with a small stress fracture who takes NSAIDs may keep training until the bone completely breaks. So in the long term, I don't see any benefits.
Yeah, and many athletes don't even realize how much damage they are doing until it's too late.
Exactly.
And what about recovery?
Well, certain pain medications, especially those that we have discussed, so NSAIDs, can disrupt the body's natural healing process. We cannot forget that inflammation is a part of healing, and NSAIDs block inflammation. And yeah, it is needed to repair the damaged tissues.
One of the biggest risks is addiction. How serious is this problem in sports?
Well, it's a huge issue in general, not only in sports, particularly with opioid painkillers. Athletes often start using them for legitimate injuries, but over time they become dependent. So I would say that athletes need to be very careful when they are prescribed with these medicines. And the general rule is that they should be taken for a short period of time, that is 1 to 7 days.
And the worst part is that most athletes don't even realize they're becoming addicted until it's too late.
Well, and that's why these kind of substances are tightly regulated in anti-doping. They're not just dangerous for performance, but also for pentathletes' health.
So I believe that we now understand what is pain and how we can manage the pain itself. So what's the best way for athletes to manage pain responsibly?
Well, as always in life, the key is balance. You should listen to your body, use medication wisely, explore non-pharmacological methods first, know the anti-doping rules, and think long-term rather than short-term.
So far, we've explored pain management in sports, so when it's beneficial, when it's risky, and how athletes can approach it responsibly. But pain isn't the only factor that affects performance and recovery. There's another key element that often gets overlooked, and that's sleep. So, yeah, athletes are focused on training, nutrition, recovery, but what about sleep? How does lack of sleep impact injuries, performance, and even pain perception? Christian, let's dive into it and let's see how important sleep actually is for our pentathletes.
I have to say that sleep is my favorite topic because it is one of the most underrated performance enhancers that you can take and those that are free. It's not just about sleeping and resting. The sleep is time when the body repairs muscle tissue, consolidates memory, regulates all kinds of hormones, even testosterone and growth hormone, and recovers from training. So poor sleep doesn't just make you feel tired, it increases pain sensitivity. We have talked a lot about pain today, slows recovery, and raises the risk injury.
I think it's quite fascinating. So what should athletes focus on when it comes to sleep?
To maximize the benefits of sleep, you should focus on 4 cornerstones. Those are quantity, quality, regularity, and timing. While quantity and quality are obvious, regularity and timing are equally important.
So what do we mean by regularity?
That's going to bed and waking up at consistent times. It helps to regulate your body's internal clock and improve overall sleep quality. I know that in real life it is very hard to actually go to sleep at the certain time and wake up at a certain time every single day. But if you give it or take, aim for 30 minutes up and down, that's actually good to go.
And how much sleep we actually need?
Well, 7 to 9 hours would be an ideal goal. I know that it is not manageable for many people, but that's the aim.
It's actually my dream to have from 7 to 9 hours of sleep per night, but yeah, maybe one day it will come. Do you have any advices or tips and tricks how to optimize sleep of our pentathletes, how to maybe improve their performance, their recovery? So
it's again quite simple. You should control your light exposure. So in the evening it should be dark, so I wouldn't use any overhead lights. I would focus mainly on using like small lamps, and even your screen time should be reduced significantly. Then what is interesting is that light in the morning is actually very important for sleep, and getting 10 to 15 minutes of natural light in the morning helps to set your internal clock.
So we actually start our sleep when we wake up in the morning?
Yeah, actually yes, because it is based on our hormones. So when it gets dark, the production of melatonin increases, and when it is morning, you should decrease the production of melatonin. It happens naturally, but if you go for a short walk, let's say, you get the benefit of exposure to sunlight, and you get a benefit of cortisol, because if cortisol increases in your body, it helps you to be awake.
What about some other factors?
Cool room temperature is always a good thing to have. I would aim for 20 degrees of Celsius, and that's really a good thing for your sleep.
I think that a lot of people, maybe athletes as well, are making mistakes with caffeine and coffee, because a lot of people can tell you that, well, I can drink a coffee whenever I want, and I just go to bed no matter what. So is this right?
Well, that might be true, because if you build tolerance, you can go to sleep even after taking a coffee just a few minutes ago. But I would certainly advise to avoid late caffeine intake. My general rule is no caffeine after 2 in the evening, because you may go to sleep, you may not experience problems with falling asleep, but your quality of sleep might be impaired. And if you are waking up a lot of times during the night, even if you don't remember it, you won't be getting those quality hours of sleep.
What about alcohol?
Well, that's another topic. Alcohol is a hypnotic, so it helps you to calm down, I would say, but it certainly doesn't help with sleep. It actually impairs the quality of sleep.
So the advice or idea that I'm gonna have few beers after my workout or after my training session, it's not a good advice, right?
No, for many, many reasons.
Definitely it's not good for your recovery. And what about the nutrition and meals, how it can impact your sleep?
Well, it depends. Eating too close to bedtime might develop discomfort or reflux for some people, but going to bed hungry can also disrupt sleep. So a small protein-rich snack, for example, 2 hours before bed, can support muscle recovery without affecting sleep too much.
We have already mentioned that 8-9 hours are optimal sleep regime, but what would happen to our body if we constantly sleep, let's say, less than 6 hours, which is like the bottom line, I would say?
Well, it can increase your pain sensitivity, and we have talked about pain quite a lot today. Then it can slow muscle repair and growth, impair reaction time, coordination, and reduce endurance and strength. So all of the bad things that we don't want. And even it can impair the function of your immune system, and you might actually get sick, which is not something that you want before the competition or important trainings.
All right, so let's wrap it up with some key takeaways. What are the most important things athletes should remember about sleep?
Get at least 7 to 9 hours of sleep per night. Keep very regular sleep schedule, actually the most regular one that you can manage. Limit evening screen exposure and overhead lights. Create a cool, dark sleep environment, and be mindful of caffeine, alcohol, and meal timing.
So, to sum up, I would say that pain and sleep are two critical but often overlooked factors in sport performance, and managing pain, responsibility, and prioritizing sleep can actually enhance your recovery, reduce injury risk, and optimize performance. And that's it for today's episode. Thanks for tuning in, and see you next time.
Thank you very much for listening.